Children can suffer with tonsillitis occasionally, and it is not very relevant for them. They will recover and never have it again. But for some children, the tonsil becomes damaged, and then it cannot protect itself, and they can suffer with recurrent infections, at which point long-term antibiotics are often ineffective in stopping these happening, and the children can suffer up to 6-7 episodes of infection a year, and at that point is where we consider removing the tonsils. Tonsils can also be too large. This can either be as a phase of growth. Children go through a phase of growth in the tonsils between the age of about 18 months and 2 years, which is a cruel trick of nature because the back of the mouth is not increasing in size, but the tonsils are. They can also grow due to infection, where they swell up and do not get small again. And some people just have large tonsils. If this is the case, they can cause symptoms, and those symptoms are difficulty breathing through the nose with perpetual mouth breathing, with drooling and potential swallowing issues. But more importantly, they can have difficulty breathing at night, and this can cause them to not rest properly. In the deeper phases of sleep, they can breath hold and have mild obstructive sleep apnea, or even worse than that. These have significant implications in the growth of your child and potentially then health problems when they are older. We also consider operations on the tonsils if one tonsil is growing for some reason we don't understand. And there are some very rare, sinister reasons for this. And in those situations, we will perform investigations to try and understand what is happening. But if there is concern, we remove the tonsils to understand exactly what is happening. Mainly, the question is around whether we leave the capsule of the tonsil, which is the border of the tonsil on this side up against the neck, intact or not. The relevance of that is that large blood vessels go from the neck into the tonsil, but beyond the capsule, within the tonsillar tissue, there are only small little blood vessels. Also, a lot of the pain fibers are associated with the capsule. Now, the modern techniques which we developed for very small children, and I see these at Great Ormond Street, where we have very young babies who need their tonsils making smaller because they cannot breathe, are being developed so that we can operate within the capsule. So we can leave the capsule of the tonsil around and not disturb the larger blood vessels. This is called coblation intracapsular tonsillectomy. And it's a fabulous technique, a little bit like taking an eraser to a pencil drawing. And we can just gently remove, shave, or whatever the word is, the part of the tonsil we do not like that is obstructing, but leave behind tonsillar tissue in the capsule so there remains functioning tonsillar tissue, but also we've not disturbed the larger blood vessels. This becomes relevant, one, for the recovery of the child, it's a much less painful technique, and two, because of the not exposing the larger blood vessels. One of the risks of tonsillectomy is getting an infection at the back of the throat in the recovery period. Your mouth is not a clean place. And if an infection happens, a bit like a scab, if the scab falls off early, some of those larger blood vessels carry the risk of bleeding. Now, that risk is small, but can be significant amounts of bleeding. If we've only operated within the tonsillar tissue, then we have a risk of a small amount of spotting bleeding or little streaks of blood in the saliva. However, we do have to remove the capsule if there is episodes of recurrent tonsillitis, and that is because there is good evidence that any tonsil tissue left behind carries a risk of becoming infected again, in which case we have to consider reoperation. So those are the two techniques we think of when addressing the tonsils. So the risk of tonsillectomy is very much around infections in the post-operative period. We will ask you and your child to have antibiotics to reduce the chance of this to the smallest it can be and allow the back of the throat to heal in the cleanest environment possible. But your mouth is not a clean place. We will also ask to take the appropriate painkillers so that the child can eat and drink, one, to stay hydrated and happy, but also to act as a physical scrape to the back of the throat so that bugs cannot build up. The risk with getting infection is that some of the blood vessels we may have seen and stopped bleeding during the operation, removing the tonsils or making them smaller, can then start to leak again and cause some bleeding, which might require, if it happens, going to the emergency room or having another, very rarely, operation to stop that bleeding. Is tonsillectomy safe? Yes, it is performed very routinely for good reasons. The modern techniques, especially the colder techniques we now use, and by that I mean not using heat of diathermy or cooking the tissues to try and stop them bleeding, but the cold techniques we now use carry much lower rates of bleeding, especially with where we leave the capsule behind. It has really transformed the child's recovery, and it is not unusual for a child to have the operation done and within a day or so now be back to normal. And you know, we're all amazed at how quickly they recover and how little pain is associated. There are questions around whether your immunity changes when your tonsils are taken out. Well, your tonsils are parts of your immune system, but if you've had recurrent tonsillitis and the blood supply is damaged, then your tonsils are not working as parts of your immune system. So actually removing them will improve your immune system because you're removing the infection that sits within them. There has been no evidence, and there have been lots of studies on children who have had tonsillectomy for the correct reasons, that there is any long-term implications associated with losing that lymphoid tissue. You do have lots of other similar tissue at the back of the mouth, the base of the tongue, that perform in the same way. So I would say tonsillectomy is safe, but only when done for the correct reasons. So will we want your child to eat? We want them to drink. Drinking lots is good and easy for the children because it's less uncomfortable to drink. But you can eat any type of food. When we're trained, we're told that we should eat scratchy foods like toast, so it scrapes the back of the throat clear. But I know, operating on children, which is all that I do, that children, if they have an uncomfortable experience swallowing after tonsillectomy, will then stop swallowing. So my advice is for them to eat whatever they want to eat, the consistencies, whatever they want, because it's the process of eating that we want them to undertake is more important than the precise food. But there is no food that they cannot eat. If you want them to eat ice cream all day, every day after the tonsillectomy, good for them. Good luck managing how energetic they will be. So the discomfort after tonsil surgery can be relatively significant. If we remove the capsule of the tonsil for recurrent tonsillitis, children fall into two groups. One group, they're so used to throat pain, they've got it all the time, they don't even complain about it. This group don't really notice having their tonsils taken out, but it's difficult to predict whether they'll be in the other group where it's very sore. Now that soreness tends to start to settle after 3 to 4 days, but comes back again after about 5 to 6 days, a spike of pain. If you've ever had a scab on your arm, you'll notice that it scabs over, and then about 5 days afterwards, it gets really itchy. Well, your throat doesn't know what itchy is very well. It just knows what's painful. And that same process is happening in the healing at the back of the throat. So it is not unusual if a child is struggling for them to get a little better, then to dip a bit about day 5 or 6, but generally by day 8 or 9, however uncomfortable this has been, they have pretty much got back to normal. Now, if we're doing the intracapsular technique where we've not disturbed the capsule, well, then sometimes children have very little discomfort, or the discomfort only lasts for 2 or 3 days. Either way, simple painkillers such as ibuprofen or Calpol are generally enough. In fact, invariably enough. In maximum cases, these can be taken every 3 hours, alternating. So Calpol, 3 hours later, Nurofen, 3 hours later, Calpol, and that can go on for several days whilst the child starts to recover. I don't advocate waking children to give them painkillers. I have 3 children of my own, and the concept of waking them up to ask them if they were in pain seems a little counterintuitive. But if you are going to let them sleep, and they sleep more than 5 to 6 hours and they've had significant discomfort before, then it will be worthy of note that they will be uncomfortable when they wake up. They will need some painkiller straight away, in which case paracetamol is best, Calpol, rather than Nurofen because their stomach is empty. And then to wait an hour or so whilst things start to settle before asking them to eat or drink, and accept that you have traded several hours of good sleep for that first 30, 45 minutes of discomfort when they wake up.